The Factor Uncensored. Colon cancer rates are surging among young people. Dr. Danish sheds light on this concerning trend and what it means for our communities. Dr. Ali, some disturbing news when it comes to young people and being diagnosed more frequently now with colon cancer. Tell us about that and why we're seeing this trend.
Yeah, Isaiah, we've seen a double the amount of cases of colon cancer in folks that are younger than age 50 years old since 1999. So there's been a significantly increase in the amount of cases of colon cancer, and some has to do with the fact that folks are getting tested more often, and that's something that's being discussed regularly by the primary care doctors. However, what we've also seen, Isaiah, is an increase in those cases as a result of dietary habits, as a result of being overweight, not taking care of yourself. COVID definitely put a factor into that as well, because folks weren't as active, weren't going out as much, were eating more processed food as well. And so all of those have made it a perfect storm for this increase in number of colon cancer cases that we're seeing here in the United States.
And before we get too far ahead in this conversation, I think sometimes we take it for granted on what people actually know. What is exactly colon cancer, and can it be deadly?
Yes, Isaiah, it can be deadly, especially if it's not caught early. Cancer itself is an abnormal growth of cells. We have millions of cells in our body, and when one or a few of them grow at a different pace, grow differently, and they expand and they become a mass, they become enlarged, that is what is considered a cancer. And in colon is a part of your stomach, it's part of your intestines. There is an increase in the number of colon cancer cases that we're seeing here in the United States in folks that are younger than 50 years of age. Historically, this was thought to be a disease of folks that were in their 70s, 80s, 90s, and even the guidelines for screening were much higher previously, and now those guidelines for screening have come down significantly as well.
And I think that sliding scale brought the suggested age for testing at 40.
That's correct.
Could it be lower now?
That 40 to 45, right, and it may be even lower if you have risk factors. So if you have a family history of colon cancer that runs in the family, or you may have other comorbidities such as, overweight, being diabetic, or having high cholesterol. Those are all kind of some of the risk factors, or even smoking or alcohol use. Those are things that increase your chances of the cancer. Number one. Number two, the other thing that we want to emphasize is that if you have a family history, either your mom, dad, your grandparents, those folks, if they have a history of colon cancer, you need to start discussing this earlier with your primary doctor, because if this is caught early, Isaiah, the survival rate is a lot higher than if it's caught later on in the stage progress.
And this is the part where we scare people and make them run, and we don't want to do that. But what are some of the early signs that would indicate you may be a candidate or you're on your path to colon cancer?
Yeah, Isaiah. So rectal bleeding is definitely one of those symptoms that you want to get explored immediately. Having any of the constitutional symptoms like fever, weight loss, unexplained night sweats, those are all things that you want to consider. If you have a change in your bowel habits, right? So maybe you're getting more diarrhea, or maybe it's more constipation, not having a bowel movement for an extended period of time. Some people go 3 to 5 days without having bowel movements, and that may be normal for you, but it may be.
Wait.
That's correct. There are folks, especially in the elderly population, that goes 3 to 5 days without having bowel movements.
Wow.
Yeah, in the hospital as well. So that all depends on your diet and how much activity. Folks that are generally in the hospital are more sicker. They're not very mobile. They're not eating as much. So that kind of puts them in that realm there. But regardless, a change in bowel pattern or bowel habits, those are all things that you want to discuss with your primary care doctor, because there are really easy screens. And I know, Isaiah, people are scared of that colonoscopy, that bowel prep that everybody hates talking about. Those are things that now there are other things that we can do. There's some blood tests, there's other things that we can do that you may not need to go through that whole horrendous colonoscopy process, perhaps.
Absolutely. We want to thank you for joining us on The Factor. You blew me away with the no restroom for 3 to 5 days. That's just my weirdness. But thank you, sir. Good to see you here on The Factor Uncensored as usual.
Thank you.